Thank you very much, Dr. Graylow and ASCO, for the opportunity to speak with you today. I'd like to share the results with you of LUMINA, which is a prospective trial omitting radiotherapy following breast-conserving surgery in T1N0 luminal A breast cancer on behalf of my co-investigators and the Ontario Clinical Oncology Group. So as a way of background, women with early breast cancer are commonly treated with lumpectomy and then followed by radiation to reduce the risk of cancer coming back in the breast, which we call a local recurrence. But radiotherapy is an inconvenient treatment, can last daily up to 5 weeks, and it's a costly therapy. And it's associated with a number of side effects, including early side effects, skin irritation and fatigue, and late side effects such as breast pain and distortion that can affect how the breast looks and affect overall quality of life. It's also associated with very rare serious side effects such as cardiac disease and second cancers. Now, over the last 2 decades, we've realized that the risk of local recurrence has been steadily decreasing. And this has been attributed to the detection of smaller screened cancers, better surgical therapies, and more effective hormonal therapy. We've also realized that breast cancer is now composed of many different molecular subtypes, in particular 4. And the first subtype, luminal A, is characterized by estrogen receptor positive protein and low Ki67, which is a measure of proliferation. And this has the lowest risk of recurrence. Now, we've done previous studies looking at clinical factors alone if they can predict patients with a low risk of local recurrence. But our question was, can we study patients with clinical risk factors that are low, but also this luminal A subtype, and can we avoid radiotherapy in this group of patients? So the general objective of LUMINA was to determine if combining the clinical pathological factors that we've used previously and the luminal A subtype can identify a woman with very low risk of local recurrence, which we defined as less than 5% at 5 years, following lumpectomy, who are treated with endocrine therapy for 5 years alone without our radiotherapy. And this is the design of the LUMINA trial. It was a prospective single-arm cohort study. We took women who were 55 years or older, who had T1, which is a cancer less than 2 centimeters, which was N0, so the axillary nodes were not involved, and limited to grades 1 and 2, which is how the cancer looks under the microscope, excluding grade 3. And they also had to have a number of protein markers, including the estrogen receptor, which had to be greater than or equal to 1% of the cells, the progesterone receptor, which had to be greater than 20%, and they had to be HER2 negative. And they were treated with lumpectomy, and then were either planned or started treatment for endocrine therapy. And then they had central Ki67 testing. And if the Ki67 was less than or equal to 13.25%, they were enrolled on the trial and had no radiotherapy. If the Ki67 was greater than 13.25%, they were treated off study. The sample size for this study was 500 patients. And here are some of the baseline characteristics of the patients. So the mean age was about 67, and you can see the majority of patients were less than 75. The mean tumor size was approximately 1 centimeter, and it was evenly split between women who had tumors less than 1 centimeter or women who had tumors greater than 2 centimeters. And in terms of grade, about 65% of patients had grade 1, and the rest had grade 2. And in terms of endocrine therapy that they received, the majority received an aromatase inhibitor, but about 40% also received tamoxifen. And these are really the primary results of our study. So when we looked at local recurrence, over the first 5 years, only 10 women had an event or had a local recurrence. And this amounted to a cumulative risk of 2.3% at 5 years, with a confidence interval ranging from 1.3% to 3.8%, which was well below our criteria of being less than 5%. When we looked at other events such as contralateral breast cancer, so that's breast cancer in the other breast that's untreated, we had 8 events for a risk of 1.9%, which is very similar to the risk of recurrence in the treated breast. In terms of any recurrence, we only had 12 any recurrences, and the rate again was very low, 2.7%. In terms of disease-free survival, which includes not only recurrence, but the risk of any second cancer or death from other causes, we had 47 events for a rate of 90% or so at 5 years. And in terms of overall survival, we had 13 events, but I'll point out that most of those women died of non-breast cancer events. Only 1 woman died of breast cancer. So the overall survival at 5 years was just over 97%. So in conclusion, women over the age of 55 or 55 with T1N0 grades 1 to 2 luminal A breast cancer following breast-conserving surgery and who were treated with endocrine therapy alone had a very low rate of local recurrence at 5 years. The prospective and controlled nature of this multi-centered study supports that such patients are candidates for omission of radiotherapy. Now, I'll just point out that over 300,000 women are diagnosed yearly with invasive breast cancer in North America. The vast majority are from the United States. We estimate that these results could apply to about 10 to 15% of these women, so about 30 to 40,000 women per year, who could avoid the morbidity, inconvenience, and cost of radiotherapy. Thank you.